Welcome to Rennis Care Radio. This episode focuses on the role of vitamin D in chronic kidney disease management. Among the therapeutic avenues explored, vitamin D emerges as a crucial element, not only due to its traditional bone health benefits but also for its systemic effects, which may improve outcomes in CKD patients. Vitamin D undergoes activation through two hydroxylation steps. The first in the liver converts it to 25-hydroxyvitamin D, and the second in the kidney produces the physiologically active form. 1,25-dihydroxyvitamin D. CKD impairs the kidney's ability to convert 25-O-D to its active form, leading to a deficiency in active vitamin D. This deficiency disrupts calcium and phosphate balance, increases parathyroid hormone levels, and can contribute to the pathogenesis of renal bone disease and vascular calcifications, conditions often seen in CKD patients. Active forms of vitamin D or its analogs have been utilized to address complications arising from CKD, particularly secondary hyperparathyroidism, SHPT. These compounds suppress parathyroid hormone production, thereby mitigating SHPT and potentially slowing the progression of CKD-related bone and mineral disorders. Research by Kim et al. 2014 emphasizes that beyond these traditional roles, vitamin D may also exert anti-inflammatory and immunomodulatory effects, offering further protective mechanisms against the progression of CKD. The prevalence of vitamin D deficiency in CKD patients is well documented, with significant correlations to adverse outcomes, including increased mortality and cardiovascular events. A systematic review and meta-analysis by Christodoulou et al. 2021 provided compelling evidence that managing vitamin D levels in pre-dialysis patients could improve overall survival and decrease morbidity. This evidence suggests that vitamin D supplementation should be considered as part of comprehensive CKD management. Despite the promising benefits, the use of vitamin D in CKD is not devoid of challenges. The risk of hypercalcemia and vascular calcification associated with certain vitamin D analogs necessitates careful patient selection and monitoring. The optimal dosing and long-term effects of vitamin D supplementation in this patient population remain under investigation. Clinicians must weigh these factors when prescribing vitamin D, ensuring that the benefits outweigh potential risks. Vitamin D plays a critical role in the management of CKD by influencing bone health, mineral metabolism, and cardiovascular function. Its benefits extend beyond simply addressing vitamin D deficiency, providing therapeutic gains that can significantly affect patient outcomes. As research continues to evolve, it is imperative that future studies clarify the optimal strategies for vitamin D supplementation in CKD, ensuring that treatment guidelines are both effective and safe for this vulnerable population. In conclusion, vitamin D holds promise as a multifaceted treatment option in CKD management. Continued research and careful clinical practice are essential to harness its full potential and improve the quality of life and outcomes for patients suffering from this chronic condition. Thank you again for joining us here on Rennis Care Radio.